Today's topic is bone cancer. Bone cancer is any type of cancer arising from the bone. Bone cancer can begin in any bone in the body, but it commonly affects the long bones in the arms and legs and the pelvis. Bone tumors may be classified as primary or secondary. Primary bone cancer is the most serious of all bone cancer, and they form directly in the bone or from bone-derived cells and tissues. Primary bone cancer is not common, and they account for far less than 1% of all cancers. Common types of primary bone cancer may include osteosarcoma. This is the most common form of bone cancer. It begins in the cells that form bones. It generally affects children and young adults between ages 10 and 30 in the bones of the leg or arm. It may also start in the hips, shoulders, or other locations. Chondrosarcoma is the second most common form of bone cancer. It forms in the subchondral tissue, which is the tough connective tissue between the bones. Chondrosarcoma usually occurs in the pelvis, thigh areas, and shoulders in middle-aged and older adults. It rarely occurs in people under the age of 20, and chances of developing it increases with age. Ewing sarcoma is a rare cancer that forms in the bones of children and young adults, and is rarely seen in adults over the age of 30. It commonly arises in the long bones of the body, such as the pelvis, arms, and the legs. Secondary bone cancer is those who metastasize from another part of the body to the bones. This type is more common than primary bone cancer. Causes. The cause of bone cancer is not exactly known, but a number of hereditary and environmental factors are likely involved in the development of bone cancers. Certain factors that are associated with increased risk may include exposure to high doses of radiation, inherited genetic syndromes, having Paget's disease, a family history of bone cancer. Symptoms: bone pain, fatigue, unintended weight loss, weakened bone leading to fracture, swelling and tenderness near the affected area, palpable hard mass in the long bones of the limbs. Diagnosis and treatment. Imaging tests can be used to determine the location and size of bone tumors and whether they have spread to other areas of the body. The type of imaging tests depends on your symptoms. This may include CT scan, X-ray, bone scan, positron emission tomography or PET, MRI. The doctor may also recommend a biopsy, a procedure that includes removing a sample of tissue from the tumor for testing in the laboratory. This can tell the doctor if the tumor is cancerous, and if so, the type of cancer that you have. The stages of the cancer are determined based on how far cancer has spread. This will help the doctor to determine the best treatment option. Tests such as chest X-ray, CT scan, and blood test can be used to determine your cancer stage. Stage 1. Cancer is confined to the bone. Stage 2. Cancer hasn't spread but may become invasive, making it a threat to other tissues. Stage 3. Cancer has spread to one or more area of the bone and has become invasive. Stage 4. Cancer has spread to the tissue surrounding the bone and to other body parts, such as the lungs or brain. Treatment. The stage, your general health, and preference will determine the treatment option. Treatment option may include surgery to remove the entire cancerous tumor, or to remove all or part of a limb if it is very large, or located in a complicated point on the bone. Radiation therapy that uses powerful energy beams, such as X-rays, to kill the cancer cell. Chemotherapy that involves using medication injected intravenously or taken orally to kill the cancer cell. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.